guys, welcome back. Today we're going to talk about the patellofemoral pain syndrome, and this is very commonly known as the runner's knee or the jumper's knee. And here you will feel the pain around your knee and in front of the knee and around the patella, that is known as the kneecap. So, for details and expert advice, we have Dr. Sadhvi Koyande with us. And she has already studied her master's in sports physiotherapy. And let's see what she has for us.
Hello everyone, this is Dr. Sadhvi Koyande. Thank you, Dr. Radhika, for having me on Life of Patient. So, speaking about patellofemoral pain, it is usually characterized by anterior knee pain, and it is most commonly seen in athletes who involve a lot into running and jumping. Hence, it is also called as runner's knee. Causes of patellofemoral pain syndrome would be direct trauma to the patella, overuse and overload of the patellofemoral joint. Anatomical factors would include women with wider pelvis, which leads to knock knees and hence might be a cause of patellofemoral pain syndrome. Biomechanical abnormalities such as wrong landing or running with knees pointed inwards. Muscular imbalances also such as tightness and weakness of particular muscles would lead to patellofemoral pain syndrome. Muscular imbalance is one of the major factors that would lead to patellofemoral pain syndrome, where there is weakness of your hip abductors and external rotators and your quadriceps, whereas there's tightness of your hamstrings, your adductors and your gastrocnemius muscle. The onset of patellofemoral pain is usually on running, especially downhill, then ascending and descending stairs, and performing weight-bearing activities that involve a lot of knee flexion, for example, squatting. The treatment for patellofemoral pain would include manual therapy, for example, mobilization of the patella and the patellofemoral joint. Then modalities that would reduce the pain, such as IFT, TENS, etc. Patella taping to correct the patella malalignment, shoe modification so as to avoid any anatomical abnormalities and cause imbalance of the muscles, and obviously exercises. The exercises for patellofemoral pain syndrome would include strengthening exercises for the weaker muscles, stretching for the tighter muscles, and other open and closed chain exercises. With the support of the ball, bend your knee and pull it back so that you get a stretch on the front of the thigh. Make sure you're not bending your body in front. You should get a pure stretch on your front of the thigh. Lift your foot and place it on the stool. All you have to do is go down, try to touch your feet till you get a stretch on your back of the leg, and hold it for 30 seconds and repeat 10 times. Cross your leg over the other and just twist behind. Hold the stretch for 30 seconds. If you get a stretch on this side, on the outside of your thigh, hold it for 30 seconds and place a towel roll under your knee and press, hold for 5 seconds, leave, repeat for 10 times and then continue for 3 seconds. The unaffected leg has to be bent and foot has to be in contact with the ground. The affected leg, you have to tighten your thigh and lift up and take it down. Repeat 10 times for 3 sets. In line, you have to move your leg up and down. Make sure you are not rotating yourself. So it has to be just straight. Your hip and knee have to be bent. All you have to do is open and close in the form of a shell. Make sure you're not rotating your hip. It has to be stabilized. Stand against the wall and then lean over it. All you have to do is you have to do partial squats and come up. Make sure your knees do not cross your toes and you're not causing pain to your knee. You have to do in a pain-free partial squat. Demonstration for side lunge. Okay, so here you move out either on the left or right, hands in front and bend the knee and go as low as possible. Then come up again, go back, other leg and go down. Lunge on the side. So these are your side lunges.
Thank you so much, Dr. Sadhvi, for being on Life of a Patient. You helped us with understanding about runner's knee and gave such a simplified explanation for it. So, thank you so much. And I hope everybody finally knows what they need to do if you suffer from this. And as I always say, relieve your pain and regain your life.